Yeah. Okay. All right. Good afternoon, everybody. Happy New Year. Welcome to the January Wellness Webinar. As you know, I'm Laura Maloof Miller. I'm a Wellness Program Manager with HealthNet, and Kristen Keela, Health Promotion Consultant with HealthNet's also on the line to help me out. Just a couple of the housekeeping items to review before we start. As always, you may have already noticed that the participants are muted upon entry. That's to help avoid any background noise. And on the screen there, if you want to change your audio settings, you simply click on the join audio icon. Also, at the end of the webinar, there'll be a quick 4-question anonymous survey. If you are having any technical difficulties, feel free to chat directly to Kristen. And to open the chat box, you simply just hover over the Zoom toolbar. Sometimes you'll see that at the top of your screen, so just look for it there. So the icon should appear. Now, Kristen's going to receive your messages in real time, and she'll respond to the messages in order that she receives them. If you happen to be attending this webinar in a conference room today, or if you happen to use a single webinar access with multiple people like a team, if you could chat that number of attendees to Kristen, that helps us get a more accurate number on attendance. All right, the information provided in this presentation is intended solely for the general information of the audience. This is not medical advice and shall not replace consultation with your physician or other qualified health provider. If you happen to have any health-related questions or problems, we ask that you please seek the advice of your physician or other qualified health provider. All right, today's topic, let's start the year off right. I'm going to review some of the common well-being tools you may have at your disposal, whether you have HealthNet as your health insurance or any other health insurance plan. All right, so we made it through the holidays. You may now be thinking about maybe a fresh start, New Year's resolutions. You may be considering some new health goals or how to get back on track if you happen to have gotten a little bit, derailed during the holiday season. So as we start the new year, it's always good to review some health and well-being programs. These can help you focus on staying fit. Perhaps you're managing a chronic illness, or if you're looking to improve or maintain your good health. So I'm going to be covering some of the typical types of well-being programs offered through wellness programs, some useful tools that will guide you on your health journey, some resources and tips on when and where to seek care. But before we dive into the subject, I wanted to just take a quick look at the differences between the words wellness and well-being. Now, wellness describes a healthy lifestyle beyond acute illness. It refers to a state of physical health in which people have the ability and energy to do what they want to do in life without chronic suffering. Now, although wellness means something different at every stage of life, it is primarily supported through habits of things like healthy eating, physical activity, quality sleep, all these things leading to positive health outcomes. Now, well-being, that encompasses a broader holistic dimensions of a life well lived. Now, although there are many different definitions, the elements of well-being that add up to a thriving life, they include different areas, such as career well-being. You like what you do every day. Social well-being. You have meaning and friendships in your life. Financial well-being. You manage your money well. And physical well-being. You have the energy to get things done. And community well-being. You like where you live. Now, wellness is an important element of overall well-being. However, wellness is just one part of a thriving life. Now, for example, consider someone who eats healthy and exercises regularly, but has very few friends and dreads going to work each day. Not only is this person struggling, but these chronic issues ultimately affect their physical health as well. So let's start off with some common well-being programs. When it comes to well-being offerings, no two programs are alike. Now, although this is a list of well-being programs available to Health Net members through our wellness or our member portal, it's likely that most health insurance companies offer similar programs. So we're going to take a look at each of these areas. Now, when we think of health promotion, these are kind of topics that come to mind. They're often digital, web-based solutions designed to improve your health, help you to make healthy lifestyle choices, and reduce your health risks. Often they're multi-week educational modules. Sometimes they come with videos and articles as well, and they guide participants to take small steps to improve their health. Now, there may be a community piece, such as an online forum that connects with others as well. When you think of healthy weight, you think of maybe losing weight or maintaining healthy weight. This would include nutrition and exercise tips. When we think of tobacco cessation, we think of assistance for helping people to quit smoking cigarettes or tobacco or vaping. The content in these types of programs, it usually includes information on how to prepare to quit, getting support, setting a quit date, addressing triggers, stress, and much more. When we think of physical activity, we think of topics that typically include things like the importance of physical activity, planning activity in your day, setting some goals, exercise types, and more. Now, with healthy eating, nutritional tips and programs on making healthier food choices are usually covered, some strategies for eating out or social events, meal planning, including how to include more fruits and vegetables in your diet, and mindful eating. And when we think about stress, I need to move this over a little bit. When we think about stress, that usually includes ways on, or tips and information on ways to stress less, coping strategies, identifying stressors, action plans, relaxation techniques. It might also include meditation or mindfulness or even deep breathing exercises. Here's our first poll. Health coaching is a great way to get personal support to help me achieve my personal health goals, but I don't have time to talk to somebody over the phone. There are no other options. Let me go ahead and launch this poll. All right. These are always optional. You're not required to participate in these, but if you'd like to, certainly go right ahead. All right, we got some answers coming in. All right, just a couple more seconds on that. All right, let me go ahead and end the poll and share the results. That is, oops, can you see the results? All right, so let me know, Kristen, if you couldn't see the results. Anyway, you got it right. That the correct answer is false. Okay. And for Health Net members, let me get rid of this one. For Health Net members, the health coaches can be reached in a variety of ways. Of course, you can talk with them over the phone, but also web, online chat. We even have secure messaging on our platform that's similar to SMS texting. So now if you don't have Health Net, look for your health coaching program with your health plan and see if they offer other ways to reach a health coach. Okay, all right. So sometimes we just need a little help to reach our personal health goals. So if you're looking for that personalized support, a health coach is a great option. So you work one-on-one with a health coach, and they help you to learn what to expect when you're trying to make a healthy change. They help you understand, learn what motivates you, and decide exactly what you want to focus on. Of course, you're going to set some specific health goals, and they're going to help you track your progress. Your health coach, helps you to stick with it. Maybe things like, maybe you want to build a fitness routine that you enjoy and that you can stick with. Or maybe you want to plan healthy meals for you or your family. Or identify life stressors and how best to manage them on a daily basis. Maybe you want to create a plan that helps you to quit tobacco or vaping for good. Or you just want to spice up your exercise routine or your healthy eating plan. Now, typically you stay with the same health coach, but that is not always the case. But don't worry. You don't have to say or think, I'm going to have to repeat my story each time I talk to a health coach. No, no, no. The health coaches have access to your file, and so they can see your progress. Now, sometimes health coaches are going to give you homework or something to work on in between the coaching sessions. You see on the slide here, the 8 areas listed. Now, these are typical topics for most health coaching programs, but also note that you're going to be matched with the best health coach for the topic area that you're interested in. Maybe it'll be a registered dietitian, a health educator. Maybe it'll be a respiratory therapist, for example, if you have asthma or some other lung issues. Next poll. All right, choosing healthy foods is part of a healthy lifestyle. Most well-being nutrition programs focus on dieting, food restrictions, and eliminating foods from my diet. Okay. Right. Gonna launch that. All right. Choosing healthy foods, part of a healthy lifestyle. Most programs focus on dieting, food restrictions, and eliminating foods from my diet. Is that going to be true or false? All right, just a couple more seconds on that. All righty. Let me go ahead and share the results here. All right, the answer is false. So 56% of you got that correct. Most people would agree that often diets really don't work for sustained weight loss. Okay, let's stop sharing that. All right. So now I'm going to use our program as an example. The Eat Right Now, this is a 28-day program that helps you to rewire your brain so that you can develop new eating habits that will lead to weight loss or to help you maintain your ideal weight with a lot less stress and effort. So this program actually works to teach you how to identify those eating triggers and to write out those cravings. Now, this is accomplished through lessons, through journaling, and there's also a community support area there within this program. It's going to give you tools to help overcome binge and emotional eating. It also includes weekly group video meetings with the program creator. This is Dr. Judd Brewer. He's a psychiatrist who's internationally known expert in the area of mindfulness training. Nutrition programs are really common in wellness and well-being programs. So to make sure to check your wellness program or your health plan's offerings for a nutrition program. Who doesn't like a challenge? Now, this is a fun way to engage yourself, your coworkers, your whole department, and maybe others in an online community. So we have a comprehensive library of challenges. Most are going to be 30 days, but there are actually a few that are 90-day challenges as well. Our particular challenges through ShareCare, they're open to everybody. You don't need to be a HealthNet member to have some fun. So some examples of online challenges. Now, these include the topics that are listed here on some like major topic areas on the slide, but we have some that have some really catchy names too. For example, Walk for Wellness or Healthier Heart. That's going to be a step challenge. We have Tired but Wired and Rise and Shine. Those are going to be sleep challenges. We have Focus on Fiber or Fuel Your Day. Those are nutrition challenges. And The Power of Music or Change Your Mind. Those are going to be stress challenges. So each month we have new challenges. So make sure to check those out. New for 2023, we have what we're calling destination challenges. So these provide an interactive experience, again, open to everybody. There are lots of popular and historical locations. These are all step challenges. So as you make progress, you're going to unlock additional educational content. Cities, think like US cities, so Boston, Chicago, New York. There's places where they have architectural locations, such as in Spain, Hungary, Turkey, Portugal. Maybe you want to walk along the Mount Everest, near Mount Everest, or Nepal, or the Florida Keys. Now you or your team, you can actually, the team challenges are going to be like walk across England, or the coastline of Australia, or the historic US Route 66. Okay, all these destinations, these are all pre-configured, and so they have a specific number of total steps. So, you know, you look on here and you see, yeah, some of these challenges, they're for individuals, while other challenges are going to be for a team. So again, look and see what challenges are available to you through your health plan or your employee wellness program. Another poll. Smoking is a leading cause of preventable death worldwide. However, quitting can be difficult to do. Is that going to be true or false? Let me launch the poll here. And usually my poll questions, this is not supposed to be hard. It's just supposed to be fun and engaging. So yes, you guys have got the answer there on that one. All right, just a couple more seconds. Good deal. All right. And let me share those results as well. Yes, that is going to be true. So if you smoke or you vape or use other types of tobacco products, quitting is one of the most important decisions, of course, you can make for your health, but it can really be hard to do. So of course, getting support is really critical to success. We know that quitting smoking or tobacco can help you reduce your risk of major health complications, such as certain cancers, heart disease, stroke, lung disease, diabetes, and more. So Health Net's no-cost tobacco cessation program is called Craving to Quit. So this is an evidence-based 21-day smoking and vaping cessation program. So it delivers this that can be accessed through our app or the website. This program helps to, again, retrain the brain using mindfulness to break the habit loop. We know that in the United States, about 70% of smokers want to quit, but only about 10% will do so successfully on their own. So this program's tools and learning modules that can maximize the odds of successfully quitting. This program includes daily tracking, digital coaching, online community, a quitting pact, all kinds of different modules, educational modules, as well as mindfulness tools. Now, again, most well-being programs will offer a tobacco cessation program. So if you know somebody who's ready to quit, you know, have them look for similar programs through their health insurance company or even through their healthcare provider. True or false? The global pandemic had no effect on our mental health. Okay. Right. Oops. Let's stop sharing that one. All right. Launched that one. The global pandemic had no effect on our mental health. Is that going to be true or false? Bunch of smarty pants on the phone today, on the line today, Kristen. That or I made my questions just too easy. All right.
We have some smart people on, that's for sure.
Yep. All right. So of course, there are the results. 98% of you have the right answer. That would be false. Okay. According to the World Health Organization, loneliness, the fear of getting the infection, suffering and death for oneself or for loved ones, certainly grief after bereavement and financial worries, those have all been cited as stressors leading to anxiety and depression. Now, if you've ever joined any of our webinars, you know this information is reviewed at the end of each webinar. And as you can imagine, this self-help program really has shown an increase in usage. It has proven tools are very effective in helping manage our mind, body, and spirit. Now, this is an online program which is available in an app form as well. So that app form through the smartphone as well as your computer, that way you can have support at home and also on the go. This really helps the people to learn to reduce stress, anxiety, depression, or substance abuse. It has modules, it has quick little videos on from mental health professionals, guided meditations, inspirations on the topics of joy, laughter, positivity, meditation, mindfulness, relaxation, COVID-19, and racism. That's just to name a few. They've got several other ones. Now, of course, this is a self-help program. It's often used in conjunction with a mental health professional. It is open to all, so you can just see that there are two different links, whether you're a HealthNet member or a community member. Also, new for 2023, we have a program called Unwinding. So this is a digital program that's based on mindfulness. So it helps users to deal with stressful events, build resilience, develop a more focused, aware, and mindful approach to life and work. Again, developed by psychiatrist and neuroscientist Dr. Judd Brewer and the behavioral health team at ShareCare. This program offers on-demand, in-the-moment tools that help ease stress throughout the day. So some of the key features of this program: really short, effective videos and audio courses. This helps our minds figure out how our minds work and how to use mindfulness in stressful situations. Guided breathing exercises are also part of the program. Mindfulness tools such as guided meditations, sleep support. So this is going to include some meditations and also white noise tracks. That's going to help users to get to sleep and stay asleep. There's lots of visual relaxation tools, and there's also live virtual events with experts, including Dr. Brewer. Now, this program is available for both HealthNet and non-HealthNet members. However, you may also find a similar program offered through your insurance company. Now that we looked at programs, let's take a look at some well-being resources. Now, this is a list that's what's available to HealthNet members, but keep in mind, these can vary by health plan, and they're not so much programs as they are places where you can go to find health and well-being information. So we'll take a look at each of these. Let's say you've got a health concern. Okay, HealthNet members, you guys can call the nurse advice line and speak to a registered nurse. This is available 24/7. It's, for those sometimes scary situations in the middle of the day or the night, or really anytime when you need professional medical advice. So most health plans will offer a similar service. Of course, you know about our monthly wellness webinars, unless this is your first time attending. If so, welcome. They are certainly open to everybody, and we offer these on the third Wednesday of the month, with the exception of December. Well, that will be the second Wednesday of the month, and they're from 12 to 12:45 Pacific time. This year, we've got a great lineup of webinars. So next month, we'll be doing Cooking for a Healthy Heart. We've got one on work-life balance, another one on expanding your well-being portfolio with green space, the benefits of acupressure, taking charge of your health, and another one is Healthy Gut, Healthy You. We've got several really great ones this year, so hopefully you'll continue to join us. They are recorded live, and the link to the recording is sent to everybody who registers. So if you register and you've got a meeting and you can't attend, no problem. And so you'll get a link to the recording probably tomorrow. And the recording link, that remains live indefinitely. So many of our clients tend to use these as like a building up their wellness library. So feel free to do that too. Now, most well-being programs, they're going to offer extensive libraries on health content, subjects from A to Z. Okay, we're no different. The health content presented on our web portal is from credible sources such as the National Institutes of Health, the Centers for Disease Control, and the American Diabetes Association. Now, HealthNet members, you're going to find lots of articles and videos. There's over 150 health topics that span these 5 areas that you see here on the slide. Who doesn't like a discount? Don't forget about these. They can help you save money on your health and well-being products and services. So our members enjoy discounts on things like weight management programs such as Weight Watchers and Jenny Craig, chiropractic, acupuncture services, of course, the eye exams, whether you need glasses or contacts, hearing screenings or hearing aids, and access to the fitness club discount. That's going to be through Active and Fit. That's our gym discount program. Maybe you need another pair of prescription sunglasses or some computer glasses, or maybe you just want to try a new gym or even an online exercise program. Now, this is an example of a promotion that's currently going. It's January and February. This is with Weight Watchers. This is for HealthNet members. So just make sure to check with your health plan to see if they offer similar discounts on wellness programs or products. Oftentimes they will. And because staying well is just as important as getting better, preventative health guidelines, now that's going to help you stay up to date with your health and the health of your family. So you tend to use these guidelines to help remind you to schedule the well care visits with your doctor. Now, note that the guidelines are often refreshed, and so they may change. So therefore, you always really should follow the care and advice of your doctor. Within the preventative screening guidelines, this is where you're going to find information on the recommended vaccines. That'll be like by age group, so 0 to 6, 7 to 18, and also for adults, as well as the recommended screening tests. That's going to be, again, for like 0 to 18, as well as for adults. And there are some recommended health screenings that are specifically listed by gender as well. So it's a really good resource. Now we're going to look at some well-being tools. So again, now they're not programs, they're not resources, but they're actual ways that you can engage on a well-being platform. This is a list of the common well-being tools. Most of these are interactive, and maybe you're already using some of these. The health risk assessment, you may already be familiar with this. This is going to give you a snapshot of your current health status and health risks. The personal health record or profile, that's a place where you can track all of your medical information. It's nice because it's all in one place. The tracker tools, now that gives you the opportunity to track additional measures, things like maybe you're tracking your sleep or medication, your steps, and much, much more. If you happen to be using a wearable device, you can often connect it so that it tracks automatically. Now, a symptom checker, this is an interactive way to determine if you need to seek medical care. And of course, the provider search, easy and fast way to find a healthcare provider near your home or your work. Now, many well-being programs are going to encourage you to take a health risk assessment each year. And you know what? Sometimes it's the best place to start. This is a great way to help you identify your highest lifestyle risks and how to improve them. Most of the time, you're going to be asked some key lifestyle questions in the areas of things like sleep, stress, nutrition, or activity. Some health assessments may actually ask questions pertaining to your behaviors, conditions, mental wellness, financial wellness, and even social interactions. If you have recent data, such as maybe your blood pressure, your current height and weight, or some recent blood test results, it's really important to include that. That way, at the end of the assessment, you really get a complete picture of your current health status. After you complete it, you're going to receive results that are unique to you with some general guidelines and things that you're doing really well, or some areas that are suggested for areas of improvement. Now, HealthNet's health assessment is called the RealAge test, and it provides our members with their real age versus their chronological age. I mean, who doesn't want to be younger than what the calendar says? We all want to be that. So our assessment can actually be taken multiple times. That's sort of a nice benefit because some assessments can only be taken, once a year or one and done. But with ours, you can take it multiple times because especially if you're making some improvements in your health, it's really nice to take it again and see those changes reflected in the health assessment. You want to see your real age going down. Now, for our members, this really is the jumping off point of our well-being program. The results are going to guide the recommendation and the personalized content on our platform. So not everybody sees the same content. For example, if your blood pressure is normal, you're not going to see any content on ways to reduce your blood pressure. Likewise, if you're not a smoker, you're not going to see content regarding tobacco cessation. Now, make sure to check with your health insurance company. This is a standard tool, so if you have the opportunity, make sure to take it. The personal health record or profile is just that, okay? This is a place where you're going to track your health care. Maybe you're working with a healthcare team, appointments, any medical conditions you might have. If you've had the immunizations, maybe it was a travel vaccine or the COVID vaccine or boosters. This is where you can keep a list of your current medications or any procedures that you've had. You can also what they call self-report, so type in data such as your recent blood pressure. Maybe you had a lipid panel, so you know your cholesterol now, you know your triglyceride level, any other screening test, you can self put that information in here. Now, HealthNet members, they can use this health record as a central location to access their health related information. And it's really nice because they can track their health historically. Again, really common offering by most well-being programs. Most well-being programs also have an area where you can track a variety of data, just like you see here, everything from sleep to medications and more. HealthNet's tracking area is on our platform is pretty unique. Our members track the 13 areas that are listed on the slide. See where the orange arrow is? And that's to earn a green day. That's when a green heart is completely full, where you can see kind of on the pink arrow, that heart is not completely full. So this is sort of like a game. It's a daily challenge that links the members' tracking information. Excuse me. It links it to the RealAge test or our health assessment. So when the eight out of 13 are green, the participant's going to earn a green day. Well, how do you earn a green day? Well, if a health factor, one of the 13 that you see there, is green. So for example, 7 hours of sleep, that earns a green for the sleep factor. Now, some factors are automatically going to be green. Like if someone indicates they're a non-smoker or if they're not taking medication, those things are automatically going to be green. We use the tracker kind of as a foundation for guiding an individual to change their behavior and to manage or improve their health. As you can see on the side there, on the right side, some of the trackers inside here are also integrated with certain devices. Now, if you don't have HealthNet, just to make sure you check out where you can track this type of information with your health plan. Let's say you overdid it with a game of football over the weekend, or you were pulling weeds and now you have a sore back, or a new pain in your body that just won't go away. Gosh, you're really busy and you're not sure if you should seek medical attention. Well, the Symptom Checker is a great tool for just this situation. You'll be prompted to answer some specific questions about your medical history and then the current symptoms, and it helps you determine the best course of action. Now, HealthNet Symptom Checker uses Ask MD. This is for a personalized evidence-based platform that uses pattern recognition software to delve into the patient's symptoms. There are approximately 100 different questionnaires covering a wide variety of common symptoms and medical conditions. Again, most well-being programs are going to offer something similar to this. And if you don't already have a primary care provider or a PCP or family doctor, or you'd like to make a change to the one that you already have, being able to search providers is a great tool that give you information that will help assist you in finding the perfect one for you and your family. Now, often you'll find this information on your health plan's website. But if you want to talk to someone over the phone, customer service representatives can help you find a provider too. Usually that number is going to be found on the back of your insurance card. But there's also a lot of variety of ways to search for a provider. You can use this tool to search by location, address, city, state, county. It's especially helpful if you're looking for a provider that you want one closer to home or closer to your work. You can search not only doctors, but specialists. You can look up urgent care centers, hospitals, medical groups. You can find different types of facilities such as labs, radiology centers, sleep disorder clinics, and more. Maybe you're looking for a chiropractor or an acupuncturist. Those alternative care providers can be found in the tool as well. You'll also want to search for a doctor based on the type of health plan coverage you have. Excuse me. You can filter by specialty, provider language, the office staff languages, accessibility requirements, even provider gender. Now, establishing yourself with a healthcare provider, we always encourage you to do that. That way they can guide your care so that you stay on the path to good health. We'll take a look at what do you do if you need medical care services. So when you or a loved one is hurt or ill, you want the best care possible. Sometimes you need care urgently. But what you may not know is that for many minor illnesses or injuries, other treatment options are available. Excuse me. Now, urgent care centers, excuse me, they can treat minor ailments. Urgent care centers are open after normal business hours. Plus, the chances are you may not have to wait as long as in the emergency room. And depending on your health insurance coverage, the out-of-pocket costs are usually lower for an urgent care center than for an ER visit. Urgent care centers can treat and evaluate fevers, vomiting, nausea, diarrhea, dehydration, strains, sprains, simple bone breaks. Always remember, if an urgent care provider thinks you need a higher level of care, they're going to get you to an emergency room. However, you want to head to the emergency room or call 911 if you have like shortness of breath, chest pain, left arm pain, left jaw pain, of course, serious burns or cuts, seizures, severe allergic reactions, stroke symptoms. If you lose consciousness, multiple injuries, things like that. Okay, you're going to want to go right to the emergency room for those things. As you know, the COVID-19 pandemic changed how we seek medical care. Now, doctors' offices limited the in-person appointments, and many patients avoided going to their healthcare provider for fear of infection. The result was a huge increase in the volume of remote and medical and behavioral health visits. Some advantages include getting an appointment sooner, provided in the safety of your own home or workplace, which of course saves time and money. Telehealth also has advantages for those who are too frail to get to their doctor's office or who don't live close to a facility. Make sure to check with your health plan to see if telehealth is covered, any co-pays and co-insurance too. Some telehealth appointments can be made through your doctor's office or through a telehealth company that your medical insurance company contracts with. You will need access to a laptop or a tablet or a smartphone, although if you're just going to be talking with your doctor, just a landline or a cell phone is fine. Now, smartphones with good cameras, they can be particularly useful for telemedicine because high resolution photos, they can help doctors see certain medical problems more clearly. For example, a photo from a good smartphone camera usually provides enough detail for a dermatologist to determine whether a mole requires further attention. Be aware that remote visit, it's not right for every situation. And of course, in case of a serious injury or severe chest pain or drug overdose, you're going to want to call 911 and get to the emergency room. Also, virtual visits are not recommended in other cases in which your doctor really needs to lay hands on you. For example, if you're seeking care from a podiatrist or a foot doctor. Face-to-face visits are generally better for young children. Kids are often require vaccinations. It's easier for doctors to monitor their growth and development in person. In general, telemedicine is effective in cases where you would typically send you to an urgent care clinic, maybe a minor injury or flu-like symptoms like fever, cough, or sore throat. It's also increasingly used for post-surgical follow-ups. Telemedicine can be a godsend for geriatric or disabled people or anyone with reduced mobility. It's great for mental health care too. It's just as easy to talk to a mental health professional over the phone in the privacy of your home instead of coming into an office. Keep in mind, though, that telemedicine does have some serious disadvantages. For one thing, it's less formal setting, which can allow some routine medical practices to slip through the cracks, such as a blood pressure measurement or lab work, which is usually or can be done, before or after an appointment. Perhaps the biggest pitfall of telehealth is the loss of that intimate, valuable doctor-patient relationship. In a recent essay, Dr. Paul Hyman, a Maine physician, reflected on the times when an unexpected discovery during an in-person examination had possibly saved a patient's life. So think about your current health and make the decision that best fits your needs. Now, we've got some great online health challenges that are ongoing, that are coming up here in February next month, and 2 specifically for HealthNet members. We have Winter Wellness and Walking in Winter. Those are both 90-day challenges that are going to run through the end of February. And again, they're open to everyone, along with Stay Sharp. That's a sleep hygiene challenge. Positive self-talk. That's monitoring how positive self-talk affects your well-being. Smart Savings is a financial wellness challenge. So you'll look at your spending habits and change one small habit in February. Boost Your Mood is a steps challenge. Physical activity can do wonders for our mood. So that's what you're monitoring there. Sugar Savvy, that's a nutrition challenge where you try cutting back on added sugars and track your progress. Now, in addition, for HealthNet members, we have Jump Start Your Heart, that's improving your cardiovascular health challenge. And Healthier You continues as well. This challenge includes achieving 60 green days during the challenge, and it's not too late to join that one. Please mark your calendar to join us in February for the wellness webinar called Cooking for a Healthy Heart. This is where we're going to explore one of the best ways to keep your heart healthy, eating foods that are good for your heart. We're going to give you some shopping and meal prep tips, watch a few cooking demonstrations, and provide you with tips on including more heart-healthy foods at every meal, whether you're cooking for one or the ever-challenging dining out. So I hope you will join me for that one. Thank you for your time today. Please remember, if you attended this webinar in a conference room or used a single webinar access with your team, please chat that number of attendees to Kristen. Everyone who registered for this webinar will receive a link to the recording in just a few days. Thank you so much. You may now exit the webinar.